Uh, good, good afternoon. Today I'm gonna be demonstrating how to apply topical medications. Um, I already set up my equipment, and which is my gloves, my tape, my three medications, my iodine, my cotton tip applicator, my tongue blades, my cotton balls, my gauze, my stereo gauze. Mm, and now after I do that, I have to check on my patient chart to grab my physician's orders to check if the medications that the doctor ordered are the ones that I have here and that they are the correct ones. So my first medication will be sulfamylon and it's correct. My second medication will be Aristocor A 0.1% and it's correct. And my third medication will be calamine lotion and it's correct. So after I put this aside, and now I have to be mindful of my 7 patient rights, and also there are some times that an analgesic will be ordered 30 minutes prior to the procedure. And now I'm going to my patient and introduce myself. Hello, my name is Carolina and I'm gonna be your MA for today. Can you please verify your name and your date of birth, please?
Fabiola Rios, February 10, 1990.
Okay, Ms. Fabiola, do you have any known allergies?
Yes, I'm allergic to penicillin.
Okay, allergic to penicillin. Okay. And after I do that, I have to go with my patient and I'm gonna have a protector so then I can protect her clothing from stain of any medication. So can you please lift off your arm, please? I put it there. I wash my hands. Now I'm gonna put on my gloves. And now I'm gonna remove any old dressing that she might have. So I'm gonna remove any dressing. So I remove her old dressing and I'm gonna discard her dressing with my gloves into the biohazard bag. And now I'm gonna put my gloves again. And I'm gonna clean her wound with a cotton tip applicator and the iodine in a circular motion from less contaminated to most contaminated. I discard this and now I'm gonna do my second check of medications. I get my physician's orders, so I check for my first medication that will be sulfamylon, and it's the correct one, so I'm gonna open it. I'm gonna get my tongue plate, and I'm gonna put the necessary medication on the palm of my hand, and now I'm gonna distribute it evenly into my patient's arm. I'm gonna put some liquid and dab it in the wound. Now after I do that, I discard my gloves. And now I'm gonna put my gloves again. To put here a new dressing. So I'm gonna grab my stereo gauze and my tape. So I'm gonna apply it. And I I take it, the wound, and discard this one. Now I'm gonna grab my other medication, which is Aristocor A0.1, and grab my cotton ball and put some medication into the cotton ball. And now I'm gonna tell my patient that I'm gonna apply this medication on her left knee. I'm gonna apply this medication that the doctor ordered in your left knee. So I'm gonna dab it, I'm gonna rub it into her left knee, and I'm gonna discard this one. And now I'm gonna check for my third medication, which is calamine lotion. So I make sure that is the correct one, and yes, it is the correct one. So I grab my medicine, I grab my cotton ball, I put it into the cotton ball, and now I'm gonna tell my patient again that I'm gonna apply some medication into her left knee. So I rub it, I dab it into her skin, and then I throw this one away. Now, after I do that, I'm gonna remove my gloves. I'm gonna wash my hands, and now I'm gonna document if the patient has any discomfort. Do you have any discomfort with the medication that I apply?
No.
No discomfort. And I document all the medicines that I did. And after that, I'm gonna do my third check, which is putting the medications away. So I have my physician's order, and I check again the third time that if the medication that I apply are correct. So it's yes, it's correct, and it's correct. So that's my third check. And now I'm gonna educate my patient about the medicine for home use. And for sulfamidone, it's gonna be twice a day or as needed, and cover it with dressing. And for Aristocor A0.1, it's on your left knee and before sleep, and calamine lotion 3 to 4 times daily as needed. Do you have any questions?
No.
Okay, thank you.